top 7 vitamins that strengthen your legs. Imagine waking up every morning with legs that feel strong, steady, and full of energy. No more muscle weakness, no more painful cramps, and no more worrying about balance or falls. If you want to stay active, independent, and confident, the secret lies in nutrition. And today, we're revealing the 7 most powerful vitamins and minerals that will help keep your legs strong and unstoppable. From boosting muscle function to protecting bone density and improving circulation, these essential nutrients can make a huge difference in how you move and feel every day. So, whether you love strolling in the park, dancing, or simply staying independent, this is the video for you. Before we get started, I'd love to know where you're joining me from today. Drop a comment below and feel free to ask any questions you have. And don't forget to hit the subscribe button and turn on notifications so you never miss out on the best health tips from Smart Health 365. Let's build a healthier, stronger future together. 1. Vitamin D. As we age, our bodies undergo inevitable changes. Muscle mass declines, bones lose density, and movements that once felt effortless can become increasingly difficult. One of the most overlooked reasons for this decline is a deficiency in vitamin D. It's not just about brittle bones. This vitamin plays a fundamental role in keeping legs strong, balanced, and functional. Let's dive into why vitamin D is the most important nutrient for leg strength in older adults, and how ensuring an adequate intake can transform mobility and overall well-being. As we age, our skin becomes less efficient at synthesizing vitamin D from sunlight. To make matters worse, many seniors spend less time outdoors due to mobility limitations, lifestyle changes, or concerns about skin damage. The result: a widespread deficiency that silently erodes muscle strength, leaving legs weak and unstable. Studies consistently show that low levels of vitamin D are directly linked to muscle weakness and an increased risk of falls. Research published in the Journal of Clinical Endocrinology and Metabolism found that seniors with sufficient vitamin D levels had stronger muscle fibers, better coordination, and improved balance, making them less prone to injuries and fractures. Conversely, those with a deficiency experienced accelerated muscle loss, making even basic activities, like climbing stairs or standing up from a chair, more challenging. Vitamin D isn't just about calcium absorption or bone health, though those are certainly important. This powerhouse vitamin directly impacts muscle function by enhancing protein synthesis and improving neuromuscular communication. Think of it as fuel for your leg muscles. Without it, they struggle to perform. Vitamin D also helps maintain fast-twitch muscle fibers, the ones responsible for quick reactions and balance. Without enough of it, these fibers deteriorate, leading to slower reaction times, weaker muscle contractions, and a higher risk of injury. It also reduces inflammation in muscle tissues, alleviating chronic pain and discomfort. If you suffer from cramps, stiffness, or unexplained leg pain, simply optimizing vitamin D levels might bring significant relief. Ignoring a vitamin D deficiency doesn't just weaken your legs. It increases your risk of osteoporosis, fractures, heart disease, cognitive decline, and weakened immunity. So, what's the solution? The good news is that boosting your vitamin D levels is simple. Sun exposure. Just 15 to 30 minutes in direct sunlight, preferably morning or late afternoon, can help, especially if your arms and legs are exposed. Just be mindful with sunscreen, as it can block vitamin D synthesis. Vitamin D-rich foods. Fatty fish, like salmon, mackerel, and sardines. Fortified dairy, egg yolks, and mushrooms can all help. Supplements. For most seniors, especially those with limited sun exposure, a supplement of 800 to 1,000 IU per day is recommended. Higher doses may be needed in cases of severe deficiency under medical supervision. If you're unsure of your vitamin D levels, a simple blood test can help. Many doctors now routinely check this in older adults. 2. Calcium. Unlike younger individuals, seniors experience a gradual loss of bone mass, which makes fractures more likely, and the legs are particularly vulnerable, with hip fractures, femur breaks, and stress fractures being among the most serious injuries older adults face. A minor fall in youth might be harmless, but without enough calcium, that same fall in later years could mean months of recovery or permanent loss of mobility. But calcium isn't just for bones. It also plays a vital role in muscle contraction. every movement, from taking a step to standing from a chair, depends on calcium triggering your muscle fibers to contract smoothly. Without enough calcium, you may experience cramps, weakness, or lack of control. This is why calcium deficiency often shows up as frequent leg cramps, sluggish movement, and poor muscle endurance. So, how can you make sure you're getting enough? Dairy products like milk, yogurt, and cheese are rich in calcium. Leafy greens, like kale and bok choy, almonds, tofu, sardines, and fortified plant-based milks are also great sources. Supplements may be necessary, especially for people with dietary restrictions or absorption issues. Just remember, more isn't always better. Too much calcium, especially from supplements, can lead to kidney stones, digestive issues, and even calcium buildup in arteries. The recommended daily intake for older adults is 1,000 to 1,200 milligrams, ideally from food with supplements as needed. Also, calcium needs movement to be most effective. Weight-bearing exercises, like walking, strength training, or light jogging, help calcium integrate into bones and muscles where it's needed most. Neglecting calcium means more than weak bones. It can rob you of your freedom, mobility, and independence. 3. Vitamin B12. When we talk about leg strength, we often focus on protein, calcium, or exercise. But vitamin B12 plays a critical role that's often overlooked. It keeps your nervous system healthy. Without enough B12, your nerves can't properly send signals to your muscles. That means your legs may feel weak, heavy, numb, or uncoordinated, even if your muscles themselves are in good shape. One of the most common symptoms of B12 deficiency is the feeling of tired or heavy legs, sometimes accompanied by numbness or tingling. Unfortunately, B12 deficiency is very common in older adults. As we age, our stomachs produce less acid, which is needed to extract B12 from food. Conditions like gastritis, acid reflux, and the long-term use of antacids or proton pump inhibitors can make this worse. And if you're not eating enough B12-rich foods, or your body isn't absorbing it well, the result is a slow but steady depletion that can cause major issues. If left untreated, a B12 deficiency can lead to irreversible nerve damage, affecting balance, coordination, and reflexes. Many older adults with frequent falls or difficulty walking may actually be suffering from B12-related nerve impairment, but it's often misattributed to aging. The good news? Restoring B12 levels can lead to a noticeable boost in energy, coordination, and leg strength. So where does it come from? Animal products are the primary source. Lean meats, fish, eggs, dairy, clams, and liver are all rich in B12. Fortified cereals, plant-based milks, and supplements are crucial for those on vegan or vegetarian diets. B12 supplements are safe and effective. And in some cases, doctors may recommend injections for better absorption. Regular blood tests can help you stay on top of your B12 levels and avoid unnecessary decline in leg strength, balance, and confidence. 4. Magnesium. Every time you take a step, magnesium is working behind the scenes. It helps your muscles contract and relax smoothly, supports nerve function, and keeps your legs from cramping, shaking, or giving out unexpectedly. One of the most common and least recognized signs of magnesium deficiency is restless leg syndrome or frequent nighttime leg cramps. These painful muscle contractions can wake you up at night and make it hard to recover from daily activities. Magnesium helps calm overactive nerves and prevents muscle spasms, making it essential for anyone who struggles with tightness, twitching, or unexplained leg discomfort. But magnesium's benefits go beyond muscles. It also plays a major role in bone strength and joint health. While calcium builds bones, magnesium guides calcium to the right places, preventing it from being deposited in soft tissues, where it can cause stiffness and joint pain. Research has shown that people with higher magnesium intake have stronger bones and a lower risk of fractures, especially in the legs and hips. So why is magnesium deficiency so common? Because it's easily depleted by stress-poor diet. Certain medications like diuretics, antacids, and blood pressure drugs. When levels drop, your legs might feel tired, sore, or weak, even after minimal activity. It's not just aging, it's often a nutritional shortfall. Restoring magnesium levels can improve energy endurance balance, freedom of movement, best food sources of magnesium include leafy greens like spinach and kale nuts and seeds, especially pumpkin seeds and almonds, whole grains and legumes, avocados, bananas, and black beans. If you're not getting enough from food, magnesium supplements can help, particularly magnesium citrate or magnesium glycinate, which are easier to absorb. When magnesium is replenished, many seniors report fewer cramps, better sleep, and a newfound ease in movement, all of which contribute to stronger, more reliable legs. 5. Potassium. Now picture this. You step out of bed in the morning, and suddenly, your calf seizes in a painful cramp. Sound familiar? That could be low potassium. Potassium plays a key role in regulating muscle function, especially in the legs. It helps balance fluids in and around your muscle cells and ensures smooth, coordinated movement. When potassium levels drop, muscles can cramp, spasm, or feel unusually stiff, especially after long periods of standing or walking. Have you ever noticed trembling legs when standing too long, or tightness when walking? These are often signs that your nerves and muscles aren't communicating properly, a hallmark of potassium deficiency. For seniors, this isn't just uncomfortable, it's dangerous. Poor muscle control increases the risk of falls and injuries. But potassium isn't just about muscles. It also supports bone health by neutralizing acids that would otherwise break down bone tissue. In fact, potassium-rich diets have been shown to slow bone loss and reduce the risk of osteoporosis. So, where can you get potassium? The best sources include bananas, sweet potatoes, avocados, spinach beans, yogurt, oranges, coconut water. If you're on diuretics or blood pressure medications, speak with your doctor, as these can deplete potassium and increase the need for monitoring. Maintaining healthy potassium levels means fewer cramps, better balance, and stronger bones and muscles working in harmony. Now, the big question: how do you ensure you're getting enough potassium to support your legs? Fortunately, nature has provided us with an abundance of delicious potassium-rich foods. Yes, bananas might be the first thing that comes to mind, but they're just the beginning. Sweet potatoes, avocados, spinach, beans, and oranges are all excellent sources of potassium. Even a simple baked potato with the skin can provide more potassium than a banana. The key is variety. By incorporating a mix of these foods into your daily meals, you give your muscles and bones the consistent nourishment they need to stay strong. Now, what about potassium supplements? For those who struggle to meet their needs through diet alone, they might seem like an easy fix, but they're not always necessary. So, how much potassium do you really need? 2,600 milligrams per day for women, 3,400 milligrams per day for men. These amounts are typically achievable through a well-balanced diet rich in fruits, vegetables, and legumes. However, and this is important, individuals with certain health conditions, such as kidney disease or high blood pressure, may need to monitor their potassium intake closely. If that's you, be sure to work with your doctor to determine the right amount. Vitamin K. When people think of nutrients for strong bones, calcium and vitamin D usually get all the attention. But here's the thing, without vitamin K, these nutrients can't do their job properly. Vitamin K is the critical link that ensures calcium is deposited in bones, where it belongs, and not in arteries or soft tissues, where it can cause stiffness, poor circulation, and even cardiovascular problems. Think of it this way. Vitamin K acts as a traffic controller, guiding calcium to the right places and keeping your legs structurally sound and mobile. For older adults, this becomes even more crucial. Studies show that people with higher vitamin K intake have stronger bones, lower fracture risk, better overall bone health. Why? Because vitamin K activates osteocalcin, a protein that helps bind calcium to the bone matrix, making bones denser and more resistant to breakage. But that's not all. Vitamin K also plays a key role in joint health and muscle function. It helps reduce inflammation in the joints, which can slow down osteoarthritis progression and ease knee stiffness, a common complaint among older adults. If your knees ache when you move or feel stiff after sitting for too long, vitamin K might be the missing link. It even supports muscle coordination and strength, particularly in aging adults. By regulating calcium inside muscle cells, vitamin K ensures proper muscle contractions, helping prevent instability, poor balance, and falls. So, where do you get it? For vitamin K1, focus on leafy greens: spinach, kale, Swiss chard, collard greens, Brussels sprouts. For vitamin K2, which stays active in the body longer and is even more effective at directing calcium into bones, reach for natto, fermented soybeans, aged cheeses, egg yolks, liver. Boosting your intake can be as simple as tossing some kale in a smoothie or sautéing spinach as a side dish. However, if you have digestive issues or are on long-term antibiotics, your ability to absorb vitamin K may be reduced. In that case, a supplement might help. Important note: if you're on blood-thinning medications like warfarin, always consult your doctor before increasing vitamin K intake, because it directly affects blood clotting and can interfere with your medication. Vitamin B6 last, but definitely not least. Let's talk about vitamin B6, also known as pyridoxine. This vitamin plays a far greater role in leg strength and muscle function than most people realize. While many nutrients contribute to mobility, B6 is essential for maintaining nerve health, supporting muscle repair, and helping the body use protein to build and preserve muscle mass. Without enough B6, even strong muscles can begin to weaken over time. Basic movements, like standing up from a chair or climbing stairs, can start to feel more exhausting than they should. One of the most overlooked signs of B6 deficiency: numbness, tingling, and unsteady walking, caused by poor nerve signaling. Many older adults mistake these symptoms for normal aging or muscle loss, when in reality, their bodies are lacking the nutrients needed to maintain proper neuromuscular function. Vitamin B6 also helps regulate inflammation, reducing muscle fatigue, and keeping the legs flexible and resilient. If you experience persistent stiffness or slow recovery after movement, boosting B6 could make a real difference. It even supports the production of red blood cells, which carry oxygen to your muscles. Low B6 equals lower hemoglobin equals less oxygen, and that means tired, heavy legs and reduced stamina. So, where do you find this powerhouse vitamin? Some of the best food sources include poultry, like chicken or turkey, salmon and tuna, bananas, potatoes, chickpeas, fortified cereals. For those with digestive issues, absorption problems, or restrictive diets, B6 supplements might be necessary. Recommended daily intake: 1.5 milligrams for older women, 1.7 milligrams for older men. B6 from food is safe, but high-dose supplements should be used cautiously. Too much over time can actually lead to nerve damage, the very thing you're trying to avoid. Your best bet? Stick with a balanced, whole food diet and supplement only under medical guidance. If you found this video helpful, please remember to hit the like button. It really helps us reach more people with this kind of valuable content. Drop a comment below and let us know your thoughts, questions, or topics you'd like us to cover next. We love hearing from you. And of course, subscribe and turn on notifications so you never miss our latest health tips and insights. Stay informed, stay healthy, and we'll see you in the next video.